All right. Well, are you ready? You know what you're an inspiration to me to start this telesummit.
I love it.
I know it because when I was at the Leadership by Design conference in Gainesville, Florida, and you were one of the keynote speakers, I was so excited because I had been thinking about doing a telesummit.
hmm
And I listened to your talk and I went, I'm going to do this.
You just got to do it.
You just got to do it. So thank you so much for
Yeah,
being
of
a
course.
guest on it. Okay, let me introduce you. Okay, I'm just going to paraphrase your introduction because it's so long.
Yeah, that's fine.
Okay, Dan Weberg is the head of clinical innovation. I'm so excited to have him on my telesummit because he is an expert in nursing, healthcare innovation, and health-centered patient design. He has extensive experience in emergency room departments, hospitals, and academics. He inspired me when I listened to him at a conference at Gainesville, Florida called Leadership by Design. His talk was so inspirational. I wanted him to speak on how he saw the vision of the future of nursing, because I think we're at a critical time in nursing to be able to move forward with inspirational ideas and what does the future hold for us and how can we take the steps to do it to create the future for ourselves as nurses and as healthcare providers. So, Dan, what are some of your ideas?
Well, we're in a time of future focus, I think. We're being catapulted into ways of work and ways of connecting that we've kind of done on the side, but now it's the new normal. And nurses are leading the way. I mean, there's story after story of nurses running towards the virus, helping, and really trying to bring the best care to patients all over the country. And I think we need to leverage that. And the future of healthcare, the future of nursing is being built right now, and crisis breeds innovation. So if we take that mindset as a profession, I think we have a great opportunity to disrupt some of the things that didn't work in the past and launch ourselves into the new normal, which is exciting.
Yes. Well, tell me some of the ways that you think we can actually take some of those steps forward. We know that we're in a time where suddenly the crisis has torn down all the normal institutions and ways of thinking. So we've kind of been waiting for this time to leap into the future. Tell me some of the ways you think we can take the actual steps to get there, and what is the vision that you see as possible for us to create and harness our energy towards?
Yeah, I think the value the value of nursing is being showcased during all of this. So I think we need to leverage that. I think sometimes in normal times people don't always know what nurses do, and now it's front and center. So I think we need to jump on that and show all the places that we're at. There's nurses in technology companies trying to help get workforce to the right spot quickly. There's nurses doing telehealth and teletriage now that used to be dominated by a physician cohort, but because they're trying to reallocate different specialties and skill sets different ways, nurses are the forefront of doing telehealth. Even down to the nursing schools, they're being forced to have to do simulation and virtual training events, which I think should be the new normal.
Right.
And the past of lecture-based memorization isn't relevant anymore. And I think we've been catapulted into a new way of thinking about all of that. And I'm excited about it, because if we can leverage technology and we can leverage the different ways that we can connect with people, both at a student level and at a patient level, there's just huge opportunities to make a more efficient healthcare system.
So that's wonderful. So let me ask you, in 10 years or within the next decade, can you tell me some of the multiple roles that nurses are going to be in? You see them doing telemedicine. You see us in, creating the new technology of the future, stepping forward and leveraging our position that's being highlighted in the world right now, and really showcasing who we are and what we do. Tell me how you see a nurse who's in a hospital right now, working at the bedside, at the front line. Tell me something that can they can see the future. They can identify the future, because right now they're in the system, they're right in the clinical demands of being here. How can we help them become the change makers of the future?
Yeah, I think the nurses have always been the change makers, and I think we just need to kind of be more vocal about it. The connection of all points of patient care are through a nurse usually, but you know, for the frontline nurses, I think this is an opportunity to step up and lead the way, to advocate for yourself and for your patients in a different way, because you've seen it, and you've had to work through poor supplies and poor systems and broken technology, and you know, for a frontline nurse, start taking notes and start going back and fixing that, because you've experienced it. I think from a global nursing kind of viewpoint, the future of nursing is so bright. There's nurses working as leaders in Amazon, building Amazon Care. There's nurses at Apple. There's nurses at Google. Nurses are working in some of the largest, most influential companies on the planet, and they're making a difference there. And I think that's really exciting. When I started in innovation, you know, like 10 years ago or so, I was able to meet with a big tech company, and they asked me, what the heck do nurses do? and you know, I was like, they asked me if I could tell them what nurses did in 30 minutes. And I was like, well, no, like, what kind of nurse do you want to know about? OR, ER, whatever. And I think now that the crisis has accelerated our profession into the limelight, I think people know what nurses do now, and we need to use that to be in all parts of the economy, from technology to economics to supply chain, and we can make a huge difference there.
Tell me about some of the things that you worked on with Amazon and Google and Apple. What were some of their projects that nurses were involved with in that innovation? Tell me some of the specifics of that.
Yeah, so well, Amazon's built their Amazon Care platform.
Mhm.
Originally, it's rolled out to internal Amazon employees, but my hunch is it's going to go big. And so there's a nurse, Christy Henderson, who is leading a lot of that work. She's built telehealth platforms across the country, and
Right.
is now at Amazon doing that. So that's amazing. I mean, she's really kind of disrupting the healthcare system from a different angle. Apple has a lot of nurse educators actually that work for them, and are building different platforms through their education work to train differently. And then, you know, they're all very secret. So, you know, you never really know what people do, but
Yeah.
Google's really big into data, right? So they're trying to look at different ways to connect with health data and provide insights for clinicians to be able to be more efficient or have more accurate answers and those type of things. And there's nurses in all those areas.
So, for example, what you were saying about Amazon, are they creating their own healthcare system for their employees, to where they're setting up a system where they can give information and treatment and innovations to their clients, to their employees online? How does that system, just, I know you can't say a lot,
Yeah.
but is it that kind of situation where they can plug into a computer and they can get their own profile, and they can help identify some of the triaging of who they need to see and where they need to go? Is that what you're talking about?
Yeah, it's really a telehealth platform. So, and again, there's not a whole lot of information out about it, but it's, you know, it's a telehealth platform. So nurses staff that, physicians staff it, and the employees can call in and do telehealth visits without having to go to their local
Right.
health system. And so Amazon's staffing it themselves with their own clinicians.
Wow.
The interesting thing about Amazon, and again, I have no idea what they're actually going to do, but they
Right.
have the whole supply chain behind it. So potentially, if they rolled this out to the world, or even just their, you know, 100,000 or so employees or whatever they have,
Right.
um, you could be diagnosed with diabetes via telehealth and some lab work that you did virtually.
Right.
And then tomorrow they would have the diabetic care kit on your front door, and you'd have your testing strips and your glucometer and your foot pads and, you know, a healthy diet. They even have groceries, so they could send you healthy food every month to make sure that you're doing
Yeah.
so. they have that entire supply chain, which makes them, I think, the most disruptive, because, Apple and Google, while they have supply chain, it's for the technology.
Right.
And they're going to be a data play, where
Right.
Amazon actually has all of that equipment in their storerooms and can potentially leverage that to get care delivery and supplies to people really quickly.
Wow. Do you also, one of the things I've always felt with healthcare is one of the things as a being a patient, you go to all these different specialists and you don't really have a whole database that you basically own, that are your labs, that are your diagnosis, that's your chart, that you can carry with you. Who would create such a platform so a patient would be able to have access to all the information of their own personal health care, and they would be in charge of, their own profile, and then they would be sort of triage to different people to keep the whole package of what they need to do to take care of themselves. How do you see that evolving?
Yeah, there's actually a couple companies now that have built sort of something like the mint.com of health data,
Mm-hmm.
where they can integrate with different health systems and electronic medical records and aggregate it into a single site. There's one called Seekster,
Right.
Seqster, that has built that. And yeah, it's the idea that the patient owns their data, and no matter who they go see across the multiple systems that they have to go to get care, that the data lives in a single spot that the patient can share. And so some of the cool value that's adding is, let's say you're a member of a Kaiser Permanente health plan, and you
Right.
move across the country, and now you have to sign up for Humana.
Right.
Normally that process takes months to get the records faxed over many times, or you have to sign all this paperwork to get the records back and forth, and then they have to be processed and then reviewed, and then you get into the system. With a solution like Seekster, the patient has all their data already on their platform. They can just push share to Humana,
Right.
and then Humana can see all of their data right there, make a decision within 24 hours, and get them into the care system as needed. And so I think those are the types of things that'll be really interesting. 7 years ago, I had a hunch that Epic was going to go direct to consumer with their EMR platform, and there'd be some subscription where they're able to, provide, a patient pays, $15 a month or something, and they get
Right.
all their data onto an app. I still think that's probably going to happen at some point. So I think the data will eventually come to the patients and be owned by the patients, but and I'm hoping the crisis accelerates that a little bit, because that's something that should have happened a few years ago.
What do you think about nursing entrepreneurs creating their own businesses? Like, for example, what just came to me as you were talking, if the thing with, let's make believe the thing with Amazon became a reality, that they could actually work with patients, get the labs, and patients would get the supplies on their doorstep, and patients had their own profile. Do you see a possibility of a nursing company or a nursing healthcare provider that would be able to create a platform of a business, like a membership, to where each patient would have their own nurse, team, or probably it would be to where he or the she could look at these patient populations and help direct some of the care and give the personal counseling and coaching that a patient needs. Because one of the things I feel in healthcare is the human interaction, the connection of being cared for. And it seems to me that we as nurses could create an entrepreneurial business to provide that kind of coaching and healthcare for people, for the population of the future. What are your thoughts about that kind of thing emerging?
Yeah, I definitely think, and there's pockets of that happening now. There's definitely nurse concierge businesses that have developed. The ones I'm most familiar with have developed around mothers and newborn babies, and having a kind of a nurse led company that comes into your home and helps you with all the things you need to learn how to breastfeed and all the things that you do with a new child, and also leveraging virtual care in that as well. I think it's called Baby Live Advice. And there's a couple others that do that as well. But yeah, I think there's an opportunity there, because if the diagnosis and treatment is done now through telehealth,
Right.
people still need help. They need help
Right.
with education, the wound care, all the things that nurses do 24 hours a day with
Exactly.
patients. And so there's a huge opportunity there to have a mobile workforce that can go into people's homes or places of work and help them actually execute on those care plans that will be potentially developed through telehealth.
That's amazing. That's a really interesting idea. I can't imagine the logistics of it, but somebody invented Amazon, somebody invented UPS, somebody invented these, let's get, all the delivery people in the world could all be, they're all on a mission, and it just seems like we could create something for healthcare providers to be able to reach out to people to answer their questions either by phone or be able to create a workforce of being able to meet people exactly where they are in their homes.
Yeah. And that's one of the goals of our company, Trusted Health. Our goal is to balance out the supply and demand of nurses, and it's really hard. There's a lot of barriers in the way. Everything from state regulation to facilities, changing the way they do compliance for these nurses and making
Right.
them do upwards of 20 hours of like online modules and handwritten math tests and all this stuff. So we have some way to go to actually create a nursing workforce that's more flexible. But
Right.
it's happening, and I think nurses are taking back control of their careers because they have digital tools now to be able to do that.
Right.
And I think, yeah, I think in the next 5 years we're going to see a big shift from nurses signing up to work for a single health system for 30 years and retire, to nurses owning their own professional practice, potentially even billing for it,
Right.
and traveling and doing the things they feel they want to do. And it's not I become a Kaiser nurse or a New York Presbyterian nurse forever, but I'm a nurse and I provide my skills and my services as patient demand requires it. And I'm more of an independent practitioner rather than part of a big corporate organization.
So tell me about your company. Tell me, is that the vision of your company?
Yeah, so our company is Trusted Health, and it was founded with the simple idea that nurses are the backbone of the healthcare system, and we need to do more to support them and their careers. And so we have a platform where nurses can build out their professional profile, everything from their license to their continuing education to their certifications and drug screens and all the things you need to actually work as a nurse in different ways. And we help them find career opportunities. So we started with travel nursing, and so
Right.
we have thousands of jobs across the country that nurses can use our platform to go apply for and go work. Especially with the
Right.
COVID-19, it's been crazy, and eventually we see ourselves as the professional home for all of nursing. So one of our goals is to have every nurse become a trusted nurse, and it puts the
Wow.
power of choice and professional practice back in the nurse's hands through transparency of data and pay and location and facilities and all that kind of stuff, so that nurses can own their practice and not have to work through recruiters and
Right.
other people that have incentives that are not aligned to the goals of the nurse.
Wow. So how long have you been working for this company, and where was it founded, and who are the leaders?
Yeah, so
And yourself.
yeah, I've been there about 7 months or so. I
Right.
started back in September,
Right.
and the founders are two amazing leaders. Lenny Slewinski is one of the co-founders. He's a CEO. His mom's a nurse, and he started this company. He's always been interested in tech, and he started the company because he saw an opportunity to really support the profession his mom was a big part of, and
Right.
so that was that. And then Matt Pierce is the other co-founder, and he spent his life uh, in labor economics and
Right.
staffing, non-healthcare staffing, and they met at a company called hired.com, and then they decided they wanted to kick off and start something to change healthcare. And it's been awesome. They're two really grounded and thoughtful leaders, and it's been a really fun time to disrupt a lot of the broken healthcare system with them.
Wow. So tell me about your aspirations in the next 10 years. Where do you see yourself evolving as an individual?
Um, I don't know. I've never really had a 10-year plan. So I've always kind of gone with what opportunity
Right,
pops up, including this
right.
one. So for me, it's where can I make the biggest impact? And, I spent a long time at Kaiser Permanente and was able to do a lot there, including opening their medical school and now joined Trusted. And now we're on a growth trajectory to really disrupt the workforce side of things. And I don't know what's next. I'm happy where I'm at, and we'll see what next opportunity comes along in the next few years, and I'll jump on that one. So for me, it's all about just fun work and impactful work, and yeah, and being somewhat of a positive deviant.
That's fantastic. Being a positive deviant. So as a change maker, and you're on the cutting edge of innovation and a new company that's emerging, and that sounds so exciting. So I would want to ask you, um, as people listen, hoping to reach as many nurses as possible with this telesummit. And what would your message be to people who are going to change the future? I know we can't do it tomorrow. We can seize the day right now. And what you were saying, which I thought was really powerful, is take notes of what's happening, write down what our needs are, write down what it needs that is actually happening in the systems, and how we can become a voice to figure out a way to meet those needs. I would love for you just to speak out of your experience, as a visionary and inspirational voice of the future. As your voice reaches out there to hopefully thousands, if not more than that, nurses around the world, and you were just saying you hoped that every nurse would be in a company like the Trusted Nurse. Please share with me just in a few moments, like what is it that you could say that gets us as nurses in all the different clinical settings we're in to listen to what the future is calling us to do.
Yeah, I think the biggest disservice to the COVID-19 crisis would be to go backwards. And so, no matter what position you are within the healthcare system, we need to disrupt it and move forward and not backwards. And so, I think that's kind of the core of the message. Taking notes about what's broken gives you an amazing opportunity to focus when you can come up for air and channel your innovation efforts. And the other piece is innovation doesn't take a long time necessarily. There's things, and that's something that the COVID crisis has also shown us. People can spin up new products in a matter of hours. And so there's never a right time. And so you have to lead forward, and you have to fail fast and fail forward. And so don't wait for some perfect time where you have enough money or enough time or enough family support. That's never going to be the right. There's never going to be the right mix there. And so do it now. There's no better time than now. And the nice thing about a crisis is it disrupts all of the traditions and assumptions that we held before. And so use that energy and channel it into whatever you think you can make better for nursing and for the healthcare system.
That's wonderful. Well, I want to tell you how much I appreciate your voice, your enthusiasm, your excitement, and your commitment to nursing. And I think it is, one of the things I've known in my career is, disrupt the system. And if the system is broken, you know, we can seize the day to make changes, and the changes meet what the urgent needs are. And I would say, look at what the urgent needs are of our system, and we can stand forth and reach out and meet those needs. And I just want to tell you how much I appreciate the inspirational talk that you gave now at this moment in the Telesummit, and the work that you're doing all over the world, because I think we need role models of the future. We nurses need to see beyond our systems. And unfortunately, sometimes the people in our systems are working so hard in the system and can't really make the innovative changes that need to be made. But having someone like you that knows the possibility and knows that we can move in new ways in the disruption really is key to how we can have the inspiration that we need, that know that we can do something different and make a new future.
Yeah, I appreciate that. It's I hope that I can inspire people to disrupt the heck out of this thing, because it's broken and we have a lot of opportunity here.
We do. Well, thank you so much. It's been an absolute pleasure talking to you. And do you have something you want? I wanted to also ask you if you wanted to offer something. We have a free gift. It could be a PDF. It could be a paint. You know, it could be anything you want, even your own poetry or a little synopsis of your vision.
Yeah, I think we will. I still have to think about what that's going to be, but we'll get it out to
Okay.
people.
Okay.
Yeah,
Okay.
I definitely have some thoughts, and we'll get it to you when this launches.
That sounds great. I think even putting the trusted nurse and the vision of what that could be as just, you know, putting it out there in the future. Because I really think when we speak, when we write, when we deliver a message, there's so many ways that we can receive messages, that the gift of your message and the gift of your vision of the future and what it is you're working on would be perfect just the way that is. So
Perfect.
it doesn't have to be anything. It can be just that. So that would be great.
Great.
Okay, thank you so much, Dan. It's been a wonderful pleasure. Keep disrupting systems and keep doing what you're doing, is because we need more people in the world like you.
I love it. Thank you so much, Mary.
Okay, great. Thank you.
Talk to you
Take
later.
care.
Bye.
Bye.